She's a professor whose research focuses on the intersection of law and science. Wendy Wagner is joining us today to discuss how the public's health is being put at risk through policymaking. This is Advocate Now. Well, you are the leading authority on the use of science by environmental policymakers, and your research really focuses on the intersection of law and science. So tell us more about that and what you're currently working on.
So I'm really interested in how the legal system is designed to make the best use of science. And I think because of the nature of democratic governance, the public at large isn't so engaged in those questions. And so we can imagine that sort of regulated industry and other concentrated stakeholders are very involved in how we design our laws, how we design our regulatory systems. So that's a long way of saying that when we actually start to see how we use science in the agencies, there's alarming shortfalls between how scientists think about science and what is trustworthy science and how we've actually designed our legal system to produce it. In ways that I actually find disturbing. So my research kind of tries to surface ways that we could architecturally sort of restructure our legal systems to do a better job producing science.
And one of the things that you really dive into is how policymakers are using science to make us sick. So how would you say the public's health is being put at risk?
Well, again, looking mostly at the design of the laws. So we're here focusing on Congress and how they actually have structured the laws. There's lots of problems that follow. I think that common sense would tell us that when it comes to things that could endanger the public's health, and I'm thinking here more products, chemicals, the way we design the laws is kind of exactly opposite from what we might think. So we would think that when it comes to chemicals or consumer products, that Congress has the agencies like EPA carefully going through each chemical, making sure it's safe, making sure we even need it. And the way the system is designed is almost exactly the opposite. So EPA is the one, in the case of chemicals in particular, that has the burden of trying to figure out whether a chemical is risky, what the toxicity data actually would be for that chemical, because manufacturers don't have responsibilities to test, whether we even need the chemical. So the burden essentially is on regulators to do a lot of the heavy lifting, even to the point of testing chemicals that are produced by manufacturers who know much better about their risks and their benefits.
Yeah, there are.
Oh, I'm sorry. Just in the case of pollution, it's slightly different. In the case of pollution, I think we've done a much better job. We had crises in the 1970s, and so now we basically tell industry to sort of set pollution limits based on what the best technology can do. There's glitches in making sure we hit that point precisely, but I think we do a lot better job regulating public health and the environment on the pollution side than on the product side, but both have lots of issues.
There are hundreds, like maybe thousands of chemicals awaiting review by the EPA. Only a handful have been banned over the last few decades. So why isn't more being done?
Well, I'd have to place the blame on the structure of the law. EPA is only able to do what the law sets out to do. They can't go beyond that. And that's the way our government is set up. And so basically the law says that manufacturers have no obligation to do any testing, even for new chemicals, unless EPA orders it, but they can challenge each of those orders on each chemical. And I should say, as a backdrop, we're talking about more than 40,000 chemicals that have been registered because they're used in significant enough quantity. So we have a huge set of chemicals. So manufacturers under the law don't have to do any toxicity data. They don't even have to synthesize the literature on their chemical, like, independent researchers in Switzerland discovered something. And they also, which I find in some ways equally troubling, have no responsibility to explain why we need that chemical. What is it used for? Are there non-chemical alternatives that are safer? And so when we actually have drilled down, we actually see some chemicals are very unsafe, and nobody really knows why we even have them in the first place, because there's much safer alternatives. So it's basically a vacuum, and EPA has the burden of figuring all of this out on over 40,000 chemicals. So that's how the law is set up today, even with major amendments. And that is, not a good place to be in terms of protecting public health.
And you touch on this, but some chemical manufacturers also commission and fund their own research. They hire scientists to conduct independent studies, and sometimes those can be misleading and dishonest. So how can those responsible be held accountable?
Well, because my research is on how we've misdesigned the legal system actually allows for a lot of this. For example, manufacturers are free to contract with independent researchers to do the research they want done, but those contracts are drafted to give the manufacturer exclusive control on how the study is designed, if it comes out in ways that are adverse, to seal it, to not allow it to ever see the light of day, and they can sue scientists who breach those contracts for millions and millions of dollars. So, for example, the idea that you can contract out research that has implications for public health, perfectly legal. In fact, the agencies don't even ask about the contractual circumstances. So we designed the laws, and we actually came out with a book, 15 years ago, and there's probably more than 50 different ways we've designed the legal system to allow all these terrible things to happen. And manufacturers have a lot of interest in controlling what the research says about their products. I mean, not only do they face the possibility of a lot of regulation, but they also could be sued and are sued when we learn about adverse effects, when we learn that things are going wrong.
So what can we all do to stay safe and protect ourselves?
We have to exercise common sense and not get too hysterical. I mean, I always feel very much like the buzzkill or the Grim Reaper with, explaining how the regulatory system doesn't protect. But I think for things that we use a lot or think we have high exposure, we want to kind of limit that exposure. I think consumers need to understand that most of the products and chemicals in use have not been tested at all, and certainly have not been scrutinized by any agency. So maybe they need to flip their assumptions about what they're coming into contact with. And that's probably the best way to be protective, and then minimize the things that seem the riskiest. I guess the sort of good news is probably these various chemicals and agents that probably do cause adverse effects are only going to cause them on a subset of the population. So I guess that's good news. I think maybe if I were going back in time, it's probably parents of young children that should be the most attentive at this point, because one thing we do know is that these chemicals and agents operate on kids because they're tiny little adults with different body weights, and their genetics are changing. And so the research coming out of pediatrics and toxicity really terrifies me. And I look at my grown children and wonder what I've done to them. So if I were going back in time as a parent, I would be pretty darn careful about what products they use to eat off, what they drink out of, as well as what goes into them.
Well, Professor Wagner, thank you so much for the research you're doing and for taking some time to talk with us today about this very important topic.
Happy to. Thank you so much for inviting me. I always love to talk about my research.
I'm Sonia Baghdady. Thanks so much for watching and advocating. For more stories and content like this, just head to advocate.com or advocatechannel.com. The Advocate Channel is here to be a voice for underserved and underrepresented LGBTQ+ and BIPOC communities. Join the conversation. Subscribe on YouTube and Facebook. Download our Roku and Fire TV app. Take us with you. Get the Advocate Channel app on your Apple or Android device. Thanks for watching. I'm Sonia Baghdady. There's more Advocate Channel after the break.